Hey guys, it's Keisha here. I'm back with another video. As from the title, you guys know I will be discussing my mental health clinical experience in this video. So if you would like to see how that went, please continue watching. Alright guys, so I'm just going to give a little disclaimer in the beginning of this video, just a little one. This is based on my opinion and my experience, so don't take it personal if you're like in the mental health field or work in the mental health field or whatever. Like, don't take it personal. It's just my opinions and my take on everything. Don't come for me in the comments, okay? However, I am open to discussing your thoughts and everything on what I'm saying in this video. However, don't talk crazy to me, okay? That's all the little disclaimer I wanted to give for this video. So my mental health clinical experience, as I stated in my previous video, was interesting. I never really talked to you guys about what I do, so before I get into that, I work as a patient care technician and also a safety companion. So I mostly work as a safety companion, which means at the hospital I sit with patients one-on-one. A lot of suicidal, homicidal, or safety issues either against themselves or others. So I sit with these people on one-on-one. So I'm kind of used to working with plenty of people with, mental health issues and everything. So I have experience in that aspect of it. So with clinical, literally on our first day, it was just a little awkward because my instructor, we paired up with another classmate, and she pretty much just dumped us on the unit and was like, all right, I'll come back and check on you guys in a few. And that was it. So like, we're in these goofy, nursing uniforms, and these people are just looking at us like, okay, who are they? So pretty much we're there for like 6 to 7 hours, and we're just expected to talk to these patients. We're supposed to use, therapeutic communication and pretty much, see why they're there, what brought them in, get their background history, just pretty much socialize with the patients. And it sounds easy, but it's not. Like, and I'm a social person, but this just it wasn't easy. And I guess I say that because once you get into like, oh, you talk to the people, what brought you in, and they say, oh, I tried to kill myself. It's like, we're expected to like see like, okay, well, technically you can't ask why questions, but we got to figure out kind of like, why did you want to kill yourself? What brought you to that decision? Things of that nature. That's pretty much what we were expected to do. So it was awkward for me because I don't know, like you don't ask people their personal business unless they like volunteered. Even at the hospital when I'm working, like I get the whole background story and everything on these patients before I even walk in the room from the nurse or whatever. So I already know why they're there, what they did, what brought them in. Like I know all that information. But I don't necessarily sit down and be like, all right, well, why you try to kill yourself? Or, oh, why did you overdose on all? I don't ask those questions. But honestly, 60 to about 70% of the time, the patients end up wanting to talk to me, and they tell me everything, and we have like a good conversation for a whole 8 hours, y'all. So this isn't like something like different for me, but you don't necessarily ask people like their personal business. Like we were expected to get like all up in their business, and surprisingly though, the patients were really receptive to us being there. I mean, they're kind of used to having my school or the students there with them, so they were really open to like talking to us and just being open with us and honestly telling us everything. So that did make it easy, having patients that wanted to talk or have someone to talk to. So I did, that did make it easy, and I did enjoy that aspect of it. I think based on the job that I have at the hospital and everything, like it pretty much was like another day at work, except for you're just with more patients at one time. Because, we're talking, we're chit-chatting with them, we played cards with them, we colored with them. That's pretty much what we did. Like, we didn't pass meds. You kind of do like a little assessment, but not really, like, not like a head-to-toe assessment or anything like that. I will say the mental health field, I don't see myself being able to work in that field. And it's not even because of the patients. I'm going to just say it. I don't necessarily agree with the treatment. As in, like, I feel like we just push a bunch of meds. Like, some of these people have some really like deep, serious issues and traumas, especially from their childhood that they're dealing with, that led to them, going down the path of being, you know, abusing the opioids and alcoholism and things. And to me, when we were there, like, we maybe had like one group session of therapy, and they would kind of like talk a little bit amongst themselves and things like that, but it wasn't, to me, it wasn't really helping. Like, I get, like, you know, you got to give medications and things like that as far as, like, you know, alcoholism or alcohol withdrawal, like, that's fatal. So I get that, and I get some people, you know, have really bad anxiety. Like, I'm not downplaying the I'm not downplaying like the illnesses or anything of that aspect, but I don't feel like they get to the root of the problem, if that makes any sense. Like, I feel like, you know, they diagnose you with bipolar and then they give you a bunch of medications to take, and it's like, all right, the medications I know are like needed to like somewhat help these people function. But as far as like the illnesses where, you know, someone was possibly raped as a child, or it just seems like we just push meds. And I don't necessarily agree with that. Like, I feel like, okay, so for example, let me go into, I'm not going to say that, you know, the patient's name or identify them as a he or she. So I'm just going to say they. So we were in, I had to go to the child unit, and this patient that I had, they were 11 years old, right? They probably were taking maybe like 8 meds or more. But they were taking like 8 meds or more. And they, you know, was diagnosed with major depression. What else did they have? PSTD. There was a couple other ones. It was a while back, you guys. Sorry, I don't remember. But they were diagnosed with maybe like 4 or 5 DSM-5 diagnoses, so like major depression. They might have had bipolar as well. Like, they were just diagnosed with a couple of things. And when I tell you this patient was on like 8 meds, and I'm like, okay, you know, they're going, you know, it's okay, they may be needed. But when I talked to the patient and they told me everything that happened, they were raped when they were 4 years old by their father, they were raped recently by their stepfather, that, like, so I have a 10-year-old nephew. So when I think of that patient and my nephew, like, my nephew is still a baby to me. He's still a child. Like, he's innocent. Like, I couldn't imagine something like that happening to them. So that just, I ain't gonna lie, like, when they told me this, like, I was speechless. I had to like step out because I did cry. Like, stuff like that. Oh God, I'm not gonna cry on camera. Jeez. Get it together. That really bothered me. Like, I can, like, for the most part, you guys, I can deal with like adult trauma. Like, in the job I have, like, I didn't came across everything. I can deal with it. But that, alright guys, I'm back. Clearly it still bothers me. So like, this patient was there, even, and it wasn't even, well, they had all of those issues and traumas from their like past, but they were recently put in this facility, or placed in this facility, because they tried to commit suicide. And from what they told me, they have flashbacks of their father and stepfather attacking them, and they would just collapse. Like, this patient was really going through a lot, and they were only 11 years old. And I'm just like, I had so many questions, so many thoughts were going through my mind, but the main thing was like, they're a child, you know, and no one deserves that, but especially a child. So, and just to see them like interact with the other kids and everything, they were happy-go-lucky, you know, they were happy. You would have never known that they had all of these issues going on. And to me, it was like, okay, we diagnosed them with these, you know, we diagnosed them and we're treating them with medication. But to me, like, the medication may be helpful, but it does nothing but just suppresses everything. Like, once the medication wears off, they're still dealing with those issues. Like, that pain is still there. And to me, like, until they, you know, go to therapy, work on that, you know, really heal from it, we're just going to keep giving them medicine. And that just wasn't even for the kids. Even though, like, when I was there at the facility, like, we didn't do any therapy sessions. Like, we just did not even one group therapy section with the children. We just sat there, watched movies, listened to music, played cards and colored and played games. But like, to me, it's like, these kids and these people are here for a reason, and we shouldn't just be throwing meds at them. Like, even with the adult units that we were on and things, like, you know, they will wake up, get their meds, maybe one group session that day, but it's like we just gave them a 50 billion meds, and then half of them walk around like zombies because of the medication just, you know, just makes them so zonked. Like, I don't agree with just giving the meds. I know that meds are necessary, especially for certain situations, like, I understand that. But in my opinion, I feel like the therapy, the counseling, like, that's what's really going to help these people. Like, not just throwing meds at them, like. And, you know, I'm not no mental health, like, counselor or anything like that, or I don't know much about, like, the overall field, and maybe there is more to it. If you guys are, like, an NP or a psychiatrist, like, let me know how it goes. But from what I saw as, excuse me, a nursing student, was that there wasn't much counseling, there wasn't much therapy. It was literally just us giving them meds to suppress their issues, and that is what I just don't agree with. Like, I can't see myself working in mental health just based on that fact alone. I'm pretty sure mental health, you know, there's a wide variety of, like, options and other aspects to it that maybe I'm unaware of, and that's fine. But just based off that, I know it's not for me. It's not for your girl at all. I'm okay. I already know what I want to do anyway, but mental health that wasn't it. But I really did overall enjoy talking to the patients, minus that experience I had in the children's department or children's unit. That one was rough. It makes you realize, like, there's really a lot going on with folks. So, you know, just because someone's happy and smiling, like, you never know what this person has been through, what they're dealing with. And it was definitely an eye-opener. Other than that, the mental health clinical experience was good. I was able to learn a lot from the patients, and it just make you realize how blessed and grateful you really should be, because it can always be worse. There's always someone going through harder times than what you're going through. So I'm definitely grateful. I want to thank you guys for watching, you know, this video, and tell me what you guys think about the mental health field, and do you think, you know, what are your take on it? Do you agree with me? Do you disagree with me? Like, what are your views on it? And stay tuned for my next video where I'll talk about my Med-Surg 2 clinical experience. Thank you guys for watching. I'll see you in the next one.